And today I'm discuss a few flashcards given in the UWorld USMLE Step 1. So let's start. I'll select in browse questions the subject anatomy, and in anatomy, since I've studied the reproductive system, female reproductive system and breast and also male reproductive system. So I'll try to use the flashcard of male reproductive system and female reproductive system. So firstly, let's go for the female reproductive system and breast. So actually there are five flashcards given in the UWorld. So we'll try to know these flashcards. Let's open first one. This is the first flashcard, sir, given in the format of uh, name the following female reproductive ligaments, and this table has been given. Whether I know or I don't know this, I'll have to select. Okay, since I know this, I'll try to recapitulate whatever I have studied using this flashcard. So the question, very beautifully designed in the UL, that I think it is about the ligaments and connections and the structures content, right? So, which ligament that connects the ovaries to the pelvic wall? As we all know that it is the infundibulopelvic ligament. Also, we say suspensory ligament. So, it is infundibulo pelvic ligament. Yes, we say also it is also known as suspensory ligament, right? Remember? Yes, and which ligament helps the cervix to attach with the pelvic side wall or the lateral wall? That ligament is the cardinal ligament. Cardinal ligament. And the ligament which help the uterus, fallopian tubes, and ovaries to attach with the pelvic side wall, that ligament is called as the broad ligament. Yes, broad ligament. And the ligament which helps the ovary to attach with the uterus, that is called the utero-ovarian ligament. Utero-ovarian ligament. And the ligament which helps the uterus to attach with the labia majora, that is known as round ligament. Yes, so these are the ligaments of the female reproductive system. Now let's see whether it is correct or not. Since I know this, I'll select this. Now see, explanation has been given here that the infundibulopelvic attaches the ovaries to the pelvic wall, and it contains ovarian artery. Cardinal ligament attach the cervix to pelvic side wall, and it contains uterine artery. Broad ligament that helps the uterus, fallopian tubes, and ovaries to attach with the pelvic side wall, and it contains ovaries, fallopian tubes, and round ligament. Right? Ovarian ligament is also called the utero-ovarian ligament. So it attaches the ovary to with the uterus, and the round ligament helps the uterus to attach with the labia majora, and it contains the artery of the Sampson. Okay, so I think I'm right. Okay, now coming to the next flashcard. See, this flashcard is as a question in the question format. Name the following structures of the superficial urogenital diaphragm. So it is about the pelvic floor muscles. You know the pelvic floor muscles. So I think the first one, this one, is what do we say? Bulbo spongiosus muscle. Sorry for the spelling mistake. And this one is known as, you remember? Yes, I think this muscle is D is the ischio cavernous muscle, ischio cavernous muscle, and this part is called perineal body. Perineal body, yes. And this part, I think it is superficial transverse perineal muscle. Let's check out. I think since I know this, I'll click. This is correct, I think. So, the explanation, I think I have told, my explanation coincides with the diagrams given in the flashcards. So obviously this is a sciocavernous muscle, this is perennial body, and this is superficial perennial muscle, and this one is the bulbospongiosus muscles. I'm correct. Now coming to the next flashcard. Now, where is the most common location for the ectopic pregnancy implantation? The ectopic pregnancy that happens outside the uterine endometrium, right? So it can happens anywhere, like it can happen in the ovary, in the fallopian tubes, in the interstitium of the uterus, even in the cervix it can happen. Okay, so it is asking the most common location. So as far as I remember, the most common location is the ampulla of the uterine tube or fallopian tube or oviduct. Ampulla of the fallopian tube. Since I know this, I'll yes, so that's correct. Ampulla of the fallopian tube is the most common site for the ectopic pregnancy. Other site is ovary, interstitium, abdominal, cervical. These are all the sites for the what? Ectopic pregnancy. Now the next flashcard is a primary. I think primary vaginal cancer is usually associated with high risk. The high risk HPV is 16 to 18 subtype. So I think HPV 16 to 18 is the high risk. It is associated with the primary vaginal cancer. When it involves the lower one third of the vagina, so it spreads to the inguinal lymph node, as far as I remember, inguinal lymph node. But if it involves the upper two third of the vagina, then it spreads to which lymph nodes? Yes, regional lymph node. I think regional iliac lymph nodes. Yes. Since I know this, I'll click yes, I know this. So I think I'm correct. Primary vaginal cancer is usually associated with the human papilloma (HPV). When it involves the lower one third of the vagina, it spreads to the inguinal lymph nodes. When it involves the upper two third of the vagina, it spreads to the iliac lymph nodes. This is also correct. And the last flashcards given in the UWorld for the female reproductive system is the name the type of fibroid based on the location within the uterus. Okay, you know about the fibroids, right? Now it's asking about the location. So I'll take this figure. Okay, so this one, I think it is also a type of what do we say, fibroids. Since it is inside the cavity, it is called intracavitary fibroids. This is called pedunculated fibroids, and I think this one is called as, what do we say, since it is inside the uterine, so what we can say, yes, intra uterine fibroids. Okay, and this one is the since it is inside the mucosa, so we will say submucosal fibroids, and this one is subserosal mucoids, and this one is, I think this is myometrium or endometrium. What we can say else? Okay, actually I'm confused about the D. So let's check out. I don't know this. Okay, so the first one A is a figure has been given here. It is pedunculated, correct. Subserosal, correct. Submucosal, correct. Okay, this one it called as intramural fibroids of the uterine. So these are all the five flashcards of the female reproductive system given in the anatomy. So that's it. I mean I really enjoyed these five flashcards tonight. Let's say tomorrow.